Good afternoon. Today's presentation is entitled Women's Empowerment, where we looked at HIV and the MDGs, particularly MDGs 3 and 6, which focus on women, girls, and HIV. MDG 3 focuses on the promotion of gender equality and empowerment as its target, specifically the elimination of gender disparity in primary and secondary education by 2005 and at all levels by 2015. MDG 6 has to do with combating HIV and AIDS, malaria and other diseases. There are two specific targets, which are to halt and begin the reversal of the spread of HIV and to achieve universal access by 2010. Universal access to prevention, treatment, care and support for all those who need it. We conducted a study on how the country is doing in terms of MDG 3 and 6. And the rationale for doing so is because we recognize there's a persistence of gender inequality and human rights and violations that put women at risk for HIV. And as well, because of that, women comprise 50% of adults living with HIV, as reported in UNAIDS Global Report of 2010. We looked in this assessment at certain indicators to measure the progress on MDG 3 and 6. We looked at, for example, the retention rate of boys and girls in secondary school, the number of domestic violence reports, the ratio of literate women to men in the age category of 15 to 24 years, the number of programs to empower women and reduce stigma and discrimination. We looked at HIV prevalence, we looked at access to treatment, and we looked also at prevention of mother-to-child transmission of HIV. We will also take a look at the existing legal framework for the protection and promotion of sexual and reproductive health, contraceptive prevalence rate, and the percentage of women and men aged 15 to 29 who receive an HIV test in the last 12 months and who know their status. We'll also take a look at the empowerment of young people to prevent HIV and the share of women, the employment of women in non-traditional sectors. I first start with a look at the country picture in terms of various issues, legislation, policy, and so on. We have found in terms of MDG 3 that males hold 331,700 or 56% of the jobs in the non-agricultural sector, as opposed to females who hold just under 250,000 of those jobs, which leads us to 40% of the jobs in the non-agricultural sector. In terms of indicators for gender equity and HIV vulnerability, we have found that the attendance amongst girls in secondary school is slightly higher at 90% as opposed to boys who register at 84%. Women represent 27% of parliamentarians in Trinidad and Tobago. We also found that there are many human rights violations amongst persons living with HIV and AIDS. Positively, however, we know that HIV treatment is free for all who need it. Male condoms and female condoms are increasingly readily available, and we see that there's a need to ratify the national gender and HIV and AIDS policies. In terms of national HIV policies and national policies, we have the post-exposure prophylaxis policy following sexual assault. We have HIV and AIDS treatment and care guidelines, management of accidental exposure to blood and body fluids, national HIV and AIDS workplace policy, and education sector policy on HIV and AIDS. And these things are important in that they help to create an enabling environment. If we look at certain specific policy measures, we found that there are contradictory policy positions between the National HIV Strategic Plan from 2004 to 2008, which was extended to 2011, and between that and the draft national gender policy. And that is something that needs to be sorted out in terms of the former promoting the human rights of men who have sex with men, for example, notwithstanding the criminalization of homosexual conduct, while the draft national gender policy expressly excludes sexual orientation as a category for discrimination. The draft gender policy makes comprehensive proposals for legislative and policy reforms, but expressly states that it does not provide measures for dealing with issues of termination of pregnancy, same-sex unions, homosexuality, or sexual orientation. And these are all critical issues that need to be addressed in the prevention and management of HIV. We have a national workplace policy on HIV/AIDS which has been developed and is closely patterned on the International Labour Organization Code of Practice on HIV and AIDS and the rules of work. We have a draft national HIV policy, but that needs to be ratified. We have a national HIV testing and counselling policy that was approved by Cabinet in 2009. And this, importantly, supports the rights of adolescents to HIV testing and treatment without parental consent. The policy also forbids mandatory HIV testing for screening of employment, and this is also very important. Taking a look again at the country picture in terms of how we're doing with our scope of international obligations. We have seen that Trinidad and Tobago has ratified key international treaties that guarantee the rights of persons living with HIV and key vulnerable groups. And these include the International Convention on the International Covenant, on Civil and Political Rights, the International Convention on Economic, Social and Cultural Rights, and the Convention on the Elimination of All Forms of Discrimination Against Women, the Convention on the Rights of the Child, and core ILO conventions. And while these have been ratified, Trinidad and Tobago, however, is not a party to the optional protocols to the International Covenant on Civil and Political Rights, the Covenant on Economic, Social and Cultural Rights, CEDAW, or the rights of the Convention on the Rights of the Child, that would allow it to permit individual complaints under these treaties. And this is very important in terms of really creating an enabling environment. In terms of a constitutional and legislative framework, Trinidad and Tobago's constitutional framework offers some protection against HIV-related stigma and discrimination against violations of the rights of groups vulnerable to HIV. However, the Constitution is limited in its state action, which prohibits grounds, its prohibited grounds for discrimination are very narrow. So therefore there's a need to amend the Equal Opportunity Act of 2000 to prohibit discrimination on the basis of HIV status or perceived HIV status and sexual orientation. Another aspect of the country picture is the implementation of international human rights obligations. How are we doing with these? In terms of the right to life, liberty, and security of the person, we find that violence against women and girls, including sexual violence, is a major issue, and therefore effective implementation of laws dealing with violence against women and girls need to be prioritized. In terms of the administration of justice and the rule of law, we have fairly progressive legislation in the country to deal with violence against women. However, police statistics show that conviction rates are very low for sexual offenses, and in fact between 2003 and 2009 this ranged from 1 to 3%. In terms of the right to work and to just, favorable conditions of work, we have the existence of mandatory testing for HIV in certain workspaces. When we look at the right to education and participation in cultural life of the community, we find that there are complaints of discriminations against HIV-positive children or children whose parents are HIV positive. Looking at the right to privacy, marriage and family life, there is a discord between the minimum age for marriage, which is lower than the age of sexual consent. In terms of looking at some of the factors that contribute to HIV vulnerability, we find concurrent relationships linked to consumerism and transactional sex. The relationship between young girls and older men comprising of exchange for sex for financial benefit. There's a prevalence of violence against women and children, emotional, financial, and physical as well. There are high levels of stigma and discrimination that exists that prevent people from accessing HIV prevention, treatment, care, and support. This slide just gives a view of the incidence of new cases of HIV during the period 2005 to 2009. And we have some indicators that really show how the country is doing in terms of combating HIV. So that is what these slides really address. As mentioned earlier, we have free antiretroviral treatment for persons living with HIV who need it, so that augurs very well for the country. In terms of high-risk behavior, we see that there's age mixing among sexual partners, so which puts the younger partner in a vulnerable state in terms of sexually transmitted infections. We find low condom use with non-regular partners, which again is an issue of vulnerability for younger women as well. If we look at expenditure on programs for women and girls, we find that adult females living with HIV registered 0.43% of the total budget for HIV of 60.31%. 37.08% on HIV was spent on the general population. 0.16% was spent on young women between the ages of 15 to 29, and 0.24% on adult females. A total of 1.2 million was spent on the prevention of mother-to-child transmission programs. Total funds spent on advocacy was 56%, and this has to do as well with adult females living with HIV and AIDS. We also gathered the views of some of the women living with HIV in terms of what they see as their own vulnerabilities to HIV and what they thought of programs for them. They thought that violence against women was a major issue and that had little redress, and we see that substantiated by statistics coming from the police in terms of the rates at which crimes are solved, abuse and so on are solved. Gender discrimination in hiring practices, they alluded to economic dependence on men as accounting for their vulnerability, stigma and discrimination associated with condom use, and they thought that very little was being done to promote the needs and rights of HIV-positive women and girls. Culturally, they also thought that women are expected to take on the care of the home, children, and work. For people with limited education, they thought that males were better able to access better paying jobs than females, and that women were increasingly financially dependent on men and use sex in exchange for financial and material goods. In terms of what is being done to empower women in the AIDS response, many of these women did not know much about that, or they thought that not much was being done that was specific to women. However, some knew of programs, government programs that have benefited women in terms of must programs emanating from the Division of Gender Affairs and then CPEP recited. So what can we say about successes in achieving MDGs 3 and 6? HIV treatment is free to all who need it. There is the provision of free distribution of female and male condoms. There is access to free primary, secondary, and tertiary education. The appointment of a female prime minister is a very positive thing. There's greater employment and income earning opportunities through government programs. There have been many empowerment workshops and leadership workshops for women. Rapid testing is available. There is a prevention of mother-to-child transmission program. There are support groups for HIV-positive persons. There are treatment sites that are geographically centralized and overcrowded, which is not a good thing. There's a high prevalence of domestic violence, including incest, and that is something that needs to be addressed. Stigma and discrimination in the workplace and in accessing health and social services is also an area of concern. And there's still the existence of misinformation, false beliefs, and inconsistency in HIV prevention messages, which, however, are not being internalized enough to make a difference. Poverty and unemployment continues. There is unequal gender roles. Women are expected to be caregivers with financial dependency on a male partner. There's limited support services for HIV-positive people, limited knowledge of the female condom, and fear of disclosure and abandonment. There's also high levels of homophobia and denial of bisexuality among men, which puts women at risk. And these are some more obstacles in terms of achieving MDG 3 and 6. There's a lack of home-based care, lack of confidentiality in health and social services, young women with older women, multiple partnering, and transactional sex. there's a lack of overall national policy on and legislation around HIV and AIDS. There is some legislation that perpetuates homophobia and gender-based violence, and the lack of a coordinating AIDS mechanism to date in 2011. Some key recommendations emanating from this study are as follows. Needed are income-generating and skills-building activities for HIV-positive women. Using the training programs and media to address HIV prevention, further support needed for HIV-positive groups. A key one is the decentralization of treatment and care utilizing peer educators. We also need consistent age-appropriate HIV, sexuality, and gender education, including for boys and girls, and discussions on gender and domestic violence. I will just pick out a few more. More needs to be done against domestic violence against women, and to support those who support the affected and infected by HIV. Condoms need to be made available in prisons, and prisoners screened for HIV. More childcare programs are needed. Stigma needs to be reduced through further rollout of the National Workplace Policy on HIV and AIDS, especially among social workers and health providers. We need continuous counseling, including couples counseling for the infected and affected. Initiatives that encourage boys to attend school are needed. Comprehensive approaches that address gender inequality specific to males and females are also needed. The role of faith-based organizations and civil society have been recognized, and perhaps that collaboration is underutilized and needs to be built. We need a national policy on AIDS along with legislation to be developed and ratified by government. So some of the main conclusions are as follows: that gender inequality and gender relations in Trinidad and Tobago impact on HIV vulnerability. Domestic violence is a major issue impacting access to HIV prevention, treatment, care, and support. There needs to be greater public awareness and gender-specific programming, and there's needed for a coordinated AIDS response.